Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Beachside Roofing.
Aloha and happy Aloha Friday. I'm Ryan Kalei Suji, joined by Yanji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. And it is, of course, our last show, obviously, of the year. And we close things out talking about COVID-19, obviously a conversation that we've had for almost every show that we've had here in 2021. But an important one today with somebody who really understands what's happening here in our community.
Yeah, we've asked Dr. Tim Brown, Senior Research Fellow at the East West Center, and of course, an infectious disease expert who we've had on before to join us because the case count is not looking good. Dr. Brown, yesterday we had, of course, the highest numbers we've seen so far in this pandemic, and today, frankly, not much better. How are you feeling about where we are right now?
Okay, obviously I'm concerned. I think there are a couple things about Omicron that are worth stressing. I mean, first is that we know that it spreads at least 2 to 3 times as fast as Delta did, and Delta was already an acceleration of this pandemic. And we're seeing that in our caseloads here. I mean, we both know that we've seen over 3,000 cases for the last 2 days, and we're still on an upward trend. I think there's no question this is going to continue for some time. It's worth noting that Omicron manifests more quickly. People start to develop illness within 2 or 3 days, whereas it was about 4 days for Delta and 5 to 6 days basically for the previous variants. So that's one of the reasons why we're seeing such rapid growth. We also know that the other factor that's really critical with Omicron is it escapes our vaccines. If we actually look at the vaccines in common use here, for example, the double dose mRNAs, the Pfizer vaccine, the Moderna vaccine. Basically, what the studies in the UK have shown is that your protection against infection with those vaccines is now down to between 20 and 35%. So you still have very, very substantial risk of getting infected, even if you're double dosed with one of those vaccines, which is certainly the case for most of the people in the islands. I think our boosting rate at this point is only about 25%. If you're boosted, your protection gets back up into the 70 to 75% range. But that's still nowhere near as good as what we were seeing originally, where we were looking at 90% plus protection against infection. Now, the good news on that is that we're still getting the protection against severe illness and hospitalization. Okay, the T cell responses, which are basically what protect us in that regard, are holding up fairly well against Omicron. So that's the one positive piece of news we have at this point. But this very, very rapid growth that we're seeing is certainly extremely problematic here in the islands. Now, in terms of our situation here, we know we're in for practically a vertical growth sort of phase. I mean, if you actually look at the charts, the graphs, and you plot them over the entire year, what it actually looks like is it looks like the jet's doing vertical climbs off of Waikiki. I mean, our caseload is basically just going straight up through the roof if we look on an annual basis. And so I think that originally, for the early part of this month, that was only happening on Oahu. But in the last week and a half, we basically have seen that replicated on all of the neighbor islands now. We're seeing the same thing on Maui. We're seeing the same thing on the Big Island. We're seeing the same thing on Kauai. And even Molokai has been showing incredible case counts for its population size over the last several days. So basically, it's taken hold pretty much across the islands. It's giving us these skyrocketing case counts. And so it's a real concern. Now, what really worries me about our situation here is we have a very constrained hospital system. We only have 2,600 hospital beds in the entire state. And the last numbers I heard were at least 2,200 of those are already filled, which means we don't have a lot of additional space. We've got some additional workers coming in mid-January basically to help out, but that's still a couple of weeks off, and our hospital counts are already starting to climb. Yesterday the report was about 140 people in the hospital with COVID here in Hawaii. And that's up from 30 to 40 cases just 3 weeks ago. So already our hospitalizations are climbing. And given the rapid growth that we've seen in cases, we expect that trend in hospitalizations to continue. And that means we could be in real trouble in terms of our healthcare system by the beginning of January to mid-January. And so we're very concerned about that. I know all the hospital providers are extremely concerned about that right now. So we're not in a good place in that regard. And meanwhile, we're not doing enough to stop the transmission. I think that's the biggest problem we're facing right now. We are really not doing enough.
Another obviously population that many are concerned about is the children, those who are eligible to get vaccinated but have not gotten a full dose of the vaccine, or those who fall in that age range below 5 years old, who don't have access or have not been cleared to get the vaccine. What are your thoughts about where we're at with children when it comes to the spread of Omicron and the impact that it could have overall?
Well, I don't think we've started to see that with children here in the islands yet. But again, we're still early. Remember, this rapid, crazy growth that we've seen of this really has only happened in the last 3 weeks or so. What they are seeing in places like London and New York City is that pediatric hospitalizations are going up very, very substantially. So I think we are very concerned about that. We don't have a clear picture. I mean, with that said, they are still much lower than adult hospitalizations, but nonetheless, I mean, any pediatric hospitalization is a serious one because we don't expect children basically to end up in the hospital. So we do need to watch that very, very closely. And it's worth noting that one of the South African studies that was done fairly early on did note about a 20% increase in hospitalizations for children relative to what they were seeing with the previous variant. So we're not alone in seeing that sort of increase. So it is something that we do have to watch very carefully.
I'm interested to know what you think the ceiling is on case counts. Yesterday, Lieutenant Governor Josh Green put out a video on his social media, as he does almost every day. And he talked about how in South Africa, they experienced basically a 30-day surge where Omicron kind of ripped through that population, and then it rapidly decreased. And he noted that we're about 20 days into our surge. And so by that metric, we would have another 10 days of these going up and then see a rapid decline. Do you think that South Africa model can be applied here in Hawaii? And again, what is the ceiling on our case count?
No, I don't believe that. I think the immune status of the population in South Africa is very different than the immune status of the population in the islands. I think there are many other factors that played out there. In South Africa, they peaked out at only about 400 cases per million. That was in terms of daily case counts. We are already at 1,600 cases per million. We're at 4 times the peak rate that was seen in South Africa. So I don't see how you could rise up to 4 times the level of South Africa and come down all that rapidly. I think this is going to be with us for some time. Another possible metric you could look at for that is that look at some of the other places where the cases are still rising. Denmark, for example. Denmark is a country where they're doing very good sequencing. So they know that Omicron is pretty much taking over their epidemic. They're very clear on that. They are currently at 2,700 per million case count. So again, they're at twice what we are. Like I say, we're at about, yesterday we were at 14, today we're at about 1,600. So Denmark is about twice ours. So we could easily see cases, I think, go up at least by a factor of 2 without straining credibility in terms of what we've seen in other places. Similarly, if we look at the positivity rate, our positivity rate currently in the islands is about 15% on test. In a lot of the other places, it's peaked out more at 30 to 35%. So again, twice the level that we're at right now. So I think we've got to be very, very careful in terms of making assumptions about how quickly this is going to be over and how quickly the strain on our hospital system will pass. I think we need to watch the case counts. This is anecdotal, but it's worth mentioning. CDC on their forecasting page has actually given up on trying to predict Omicron. Okay, on their forecasting page, they have a statement that says that the predictive ability over the next 1 to 4 weeks is so bad that we're not reporting it anymore. And I actually went to the site where they actually give all the different forecasts that they use in their so-called ensemble model. And basically they're all over the map. They have some models that go up to 20,000 cases a day. They have other models that have already turned over and gone down, which clearly is not true in terms of our current caseloads. So I think that anybody who tells you we know how this is going to play out over the next month to 2 months, I think is not dealing from reality. I think we just don't know at this point. But there's certainly room for continued expansion relative to what we've seen in other places.
When we look at the narrative overall of this virus and how this, how politicians and how elected officials have been framing this, really, there was that large push for people, obviously, to get the vaccine and to get boosted. And now, really, the narrative has turned into really just getting boosted so that if you do get it, you won't get as sick and you maybe will prevent yourself from going into the hospital. Do you believe that that is enough at this point in time? I mean, we've seen statements made, by the current mayor, Mayor Blangiardi, who has said that that they will leave it to people to have, be personally responsible for their actions, and that, of course, getting the vaccine will help people not get as sick should they get it. Do you think that is enough moving forward, or do you think that more regulations are needed at this time?
I think boosters are an important step. A study actually just came out in the UK this morning, and basically they're finding that boosted individuals see their hospitalizations reduced by 90% relative to an unvaccinated individual. So there's no question that boosting is very, very beneficial in that regard. Boosting also, as I mentioned earlier, gets your protection against infection back up in the 70% range. Now, that's still, like I say, not the 90, 95 that we were looking at in the early stages of the epidemic, but it's much better. So it's reducing 3/4 of the infections that might have otherwise occurred among boosted individuals. So that's going to help, but it's clearly not enough. Our boosted population at this point is only about 25%. And so we've still got a lot of people who aren't boosted. We've got a whole bunch of people who aren't even eligible for boosters now under the 6-month guidelines. So basically their protection at this point against infection is 20 to 30%. It's extremely low. Okay. So just the boosting alone is obviously not going to stop this. We also need to up our game in terms of layers of protection. The next and most critical layer is masking. And we need people not only to mask, but we need them to improve the quality of their mask. They've got to switch over to using N95s or KN95s, higher quality masks that do a better job of basically not permitting air basically to get into the mask, except through the mask itself, not through the sides, not through the edges, because that increases your chance of potentially getting infected. So better masking, I think, is critical. Throw away those neck gaiters and the cloth mask that people are using. Or if you're going to use the cloth mask, use it with a surgical mask underneath, double mask. That's been shown to be very effective. The other thing we've got to do, like I say, it has to be layers of protection. We've got to stop avoiding crowded places. Crowded places are an invitation to Omicron. This one is extremely transmissible, much more so than even Delta was. So frankly, at this point, if you are going to restaurants and sitting around for an hour, unmasked with a whole bunch of other people in that restaurant who are also unmasked, and given the very, very high rates of Omicron that we have in the community right now, it's almost a certainty that probably somebody in that restaurant with you has COVID. The chances of getting infected are extremely high. So my recommendation is do takeout, support the restaurants, but do it through takeout and other things, not by actually going in and risking infection. Also, these large crowd events have just got to be called off, period, end of story. I mean, we know even the outdoor ones like that concert at Bishop Museum have led to Omicron transmission. Big crowds are not safe any longer. And if people are going into them, especially with the New Year's holiday coming up and a lot of people wanting to go to large parties and celebrate, my recommendation, have a nice, intimate New Year's celebration at home with your immediate family and very, very close friends who you spend time with. That way you're not exposing yourself to a whole bunch of other people who potentially have an unknown risk basically for having Omicron at this point. And also, if you can, use rapid tests before you go into family gatherings and parties, because those can also help to identify that. So we need these layers. We need the boosting, yes. We need the masking. We need avoiding large crowds. We need using tests appropriately, basically as a protective measure. And we also need to improve our ventilation. If you're getting together with people, open all the doors and windows, get the fans blowing, anything you can basically to keep the air moving through your place. That will go a long way. If you can go outdoors, unfortunately not very likely today with the weather, but if you can, take it outdoors. Okay, so I think, we need all of those layers. Otherwise, we're not going to stop this extremely rapid spread we're seeing right now.
Another layer is, of course, the Safe Travels program. There's a question here from Kara. Please ask if he thinks we should require testing of all travelers like we did prior to July 8th. Does it even matter anymore, given the rate that we have now? Would testing and adding that layer of protection make a difference for our population?
I think the layer of protection that I would rather see added is boosting. Although actually what I want to see is both. I want to see boosting as a requirement, the vaccination requirement for safe travels, and a 24-hour pre-flight test. If it were possible, I would actually ask the airlines to do a rapid test immediately before people get on the plane. Except the airlines I know will refuse to do that and claim that it's too much burden on them. But both of those I think should be requirements. Part of the reason for the boosting is we've already gotten reports of tourists getting sick here and then having to quarantine before they go back. As the Omicron situation becomes more severe across the United States, we are going to see more and more people coming here during their incubation periods. And if, for example, they were only doubly vaxxed, which is enough to get them by safe travels, they're not really protected against Omicron. They've got 20 to 30% protection. That's about it against infection. So fundamentally, the vaccination requirement alone at this point is inadequate to really keep COVID from coming in. And if we bring in people who are already infected and already incubating, some of them will become sick here. And some of them eventually, especially the older ones, will potentially become seriously ill and may add an additional burden to our healthcare system that we absolutely do not need right now. Our own local residents are going to fill up our hospitals very, very quickly over the next month or so. And so we don't really have additional space basically to add more people into that mix. So I think there are multiple reasons why we should be doing that. And we should be doing it rapidly. We shouldn't be talking about doing it 3 to 4 weeks from now. We should be talking about doing it now.
I think a question that many people are wondering simply is how do we get out of this? We were on such a good track with many in our community vaccinated, and then Omicron obviously has changed all of that through just this variation of this this virus. Looking ahead, what's to say that another type of Omicron does not spout up again next year or down the line? I mean, many people are looking at the end game here, and then how do we get through this with so many variables at stake here?
Well, I think, the first thing is I would not give in to fatalism. Do not give in to these people who are saying, oh, everybody's going to get infected with this. That's not true, and it is not desirable. Okay. We still do not know the longer term consequences of infection with Omicron. We're told it's less severe. Okay. And certainly, I mean, there is some support for the less severe claims in terms of, yes, there seems to be less hospitalization. There seems to be less severe illness among those who are hospitalized. Fewer of them have to go on oxygen. So that's absolutely true. But we know nothing, absolutely nothing, about the longer term effects of this. Nothing about the long COVID type side effects that might be associated with Omicron. And in the absence of that, to just say, let everybody get infected makes no sense from a public health perspective. You're potentially just kicking the can down the road, quite literally, until our collapsing public health structure basically crushes the can, which is basically what will happen here, given the rapid rise in this. Even if hospitalizations are reduced by 2/3, that 1/3, when we have 4 to 5 times as many cases, will easily produce as many hospitalizations as what we saw in the Delta wave. And I should also point out, in South Africa, like I said, they found that the number of hospitalizations in their Omicron wave in the first 4 weeks was the same as the number in the Delta wave in the first 4 weeks. So that lower hospitalization is counterbalanced by the much, much higher rate of spread. So if we don't contain that rate of spread, even with less severe illness, we will still end up overwhelming our hospitals. And so we've got to really be concerned about that. And
I
we
want
don't know anything about the long-term effects. And that's what I really worry about, because those are not mild long-term effects we are talking about. Anywhere between a quarter and 50%, depending on the study you look at, suffer long-term effects such as ongoing fatigue, brain fog, inability to concentrate, things that actually can affect your ability to work. And that's what we observed with the previous variants. We don't know any of that with Omicron because we're so early. Remember, we only found out about this thing literally a month ago. So we're still learning, and we don't have any idea how it's going to play out 3 or 4 months from now and what type of long-term effects it may have on people. So telling people, oh, it's mild, don't worry about it, it's okay if you get infected. No, you really don't want to get infected at this point. We don't know enough. And certainly it's risky to do so.
I want to follow up on Ryan's question about pediatric cases. Given that school is starting next week, we have over 100,000 children who are going to be going back into what amounts to large gatherings. They obviously have to have lunch, have a drink of water every now and then. They ride a bus, many of them. What are your concerns about kids going back to school? There are some parents actually in the comments saying, should I keep my kid home for a couple of weeks? What are your thoughts on that?
I think parents need to make that choice. I do think, personally, if I were calling the shots, obviously I'm not, I would probably delay the opening of schools for a couple of weeks and push the summer back a couple of weeks until such time as I could ensure appropriate ventilation in all of the schools. I would actually, if I had my druthers, I would actually have the schools handing out high quality masks to all of their students and teachers, not depending on what the kids happen to bring from home. And I actually think the state should be distributing high quality masks to everybody, parents and children alike. And I would, definitely rethink my distancing. Omicron has upped the game in terms of transmission. If we're talking about 3-foot distancing now, I don't think that's appropriate with Omicron. It's much, much more transmissible than Delta was. And so I think that, we need to make sure our schools are safe before we reopen them. And I would take some time basically to put safeguards into place to try to reduce that transmission. And then when they open, monitor them closely. If you see the transmissions going up substantially, then go to distance learning.
What are your thoughts on the CDC's new recommendation on the quarantine period for those who have tested positive? It has gone from 14 days at one point to 10 and now down to 5. And the state has also weighed in on this, saying that they will follow the CDC's advice when recommending individuals who are, who do get infected to follow this 5-day sort of period. Your thoughts on just this new recommendation that was released earlier this week?
My personal opinion is it's another poorly considered recommendation on CDC's part, the first of many throughout this entire pandemic. There is no evidence at this point that transmission stops at 5 days. While yes, they may be saying the majority of it seems to happen in the first 5 days, I don't believe we have the epidemiological studies to back that up. The one study which I know they're relying on was of the Christmas outbreak in Norway in Oslo at a restaurant. And yes, there most people did develop illness at about 3 days, but there were people out at 6-7 days who were still developing symptoms. So those people would not be captured by this 5-day quarantine. Now, the UK has been doing something similar. They have a 7-day quarantine period. But to get out of it, it is followed by 2 rapid tests. You have to have 2 successive negative rapid tests before you can come out of quarantine. And CDC should have put that into their recommendations. But they did not. Why didn't they? Because we have a testing shortage in this country. Well, I'm sorry, lack of testing capacity is not a good reason for making public health policy. Public health policy should be based on public health considerations. And they should be looking at requiring that rapid test, at least 1, preferably 2, before people kind of out of isolation at that point. Otherwise, they can potentially spread an extremely infectious thing. And so they say, oh, but we say wear masks for 5 days. You're supposed to be wearing masks all the time. Why are we now saying, oh, wear masks for 5 days? They're almost assuming that other people are not wearing masks, which certainly in this state is not supposed to be the case. Everybody is supposed to be wearing masks indoors. So I think I've got real problems with their 5-day. I think it's too short.
Can you tell us, are there other variants on the horizon? I know that you monitor cases across the globe. What are you seeing, and what concerns you coming up in 2022?
There's nothing I'm aware of at this point, although again, the bandwidth is largely consumed with Omicron at this point. There certainly are worries about Omicron itself. It is not done mutating. And in fact, there are sublineages, basically children of Omicron, that are starting to develop already that have different mutations that some of which may eventually end up affecting both its transmissibility and its immune escape. And so those have to be monitored closely. And of course, people are trying to monitor those very, very carefully. We saw that with Delta. With Delta, we had the so-called AY4 variant that was starting to come up and seemed to have a 10 or 15% advantage over the old Delta. But then Omicron came in and totally cleaned its clock. So we do have to worry about, Omicron continuing to mutate itself. And then we've got to watch for the next Omicron on the horizon. The thing I will remind you, we are now 24 months into this pandemic. We count it basically from December of 2019. We have had 5 different variants take over the world at one point during that time. So we've only got about 5 months before significant variant changes based on the last 2 years of experience. Okay, so that does to me imply we may actually be dealing with another variant or two coming into the next year. And so we need to be prepared for that. And I think what we need to do is we need to make our entire system more resilient. Okay, we basically need to improve our testing capacity so tests are readily and freely available to people. We need to make sure our hospital capacity is there if we have to surge at some point again in the future. We need to make sure that society is prepared for the fact that this thing is not going away and that just a vaccine is not enough to stop it if it's spreading in the community, that they have to be ready to mask up again when necessary. And right now, this is not the time to unmask, believe me. The next month or two, you absolutely want to keep your mask on in public places. And I think that society needs to be prepared for that. And we need to stop peddling this fiction that we are going back to the way things were in 2019. I mean, until we are totally past Omicron and we have controlled the transmission across the globe, we are going to continue to see these problems. And the final piece of that solution is we need to get vaccines to everybody in the world. The fact that this arose out of most likely African settings where vaccination rates were below 10% in many countries is a condemnation of our failure to deliver vaccines to most of the lower and middle income countries. And that's a failure the entire globe shares. And so I think we need to work to build vaccine capacity in every country so every country can scale up their vaccines on a 2 to 3 month time frame. Because when the next one comes, we can't afford to take 2 more years to get the world vaccinated against it if we come up with a good vaccine against it. We need to roll that vaccine out in 2 or 3 months. And that means we've got to build our vaccine production capacity in countries, not just rely on a bunch of Western companies to produce the vaccines.
Unfortunately, our time is up, and it goes so quickly, half an hour in having this discussion. We really do appreciate you being on the program and answering some of these questions and painting a picture of what is happening out there, and not only in our community, but really for the broader, broad perspective of what's happening with COVID throughout the world. So thank you so much, Dr. Tim Brown, for joining us once again this morning.
My pleasure.
Aloha.
Thank you, and Happy New Year. Wow, Ryan, very sobering interview there. Interesting to hear from Dr. Brown, and he really laid out what sounds like a pretty dire picture for the state. If you look at the models, Dr. Josh Green, who of course is our lieutenant governor, is relying on the South Africa experience, but Dr. Brown saying that is not necessarily being replicated here. We're seeing a much higher caseload, and that could translate to a lot more hospitalizations. That basically, I thought it was, really well put when he said that the lower hospitalization rate kind of doesn't matter when you deal with such high case counts. And that's really what we're seeing reflected in our community.
We also heard from him recommendations that he would have and is providing to those that he speaks to, and saying that, just having that cloth mask is not enough. He's really encouraging people to get those higher grade, those surgical masks, those K and N95 masks that are used to ensure that you are protected, or going for a double mask if you are using that cloth mask as well as calls for more testing. Of course, something that he has been sounding the alarm for some time now, and hearing his thoughts about where the state is going, and that large gatherings at this point in time is just not a good idea.
Yeah, something to think about as we head into our New Year's celebrations, saying that rapid tests are a great idea. Obviously, if you can be outside, open all the windows, increase your ventilation, but really encouraging people to kind of hold off. And also, the Department of Education is not following this guideline, but he says if it were up to him, he would actually delay school for a couple of weeks, hand out appropriate masks to basically the entire state, and then extend the summer to give time for more ventilation and kind of let Omicron, fizzle out a little bit more, or at least get the case counts down. Kind of sobering and scary to think about the children of Omicron right now, kind of throughout our community developing, he said, and those mutations that are currently happening, undetected by us.
We see a lot of the comments and questions that have come in. We encourage you to, for those of you who came into this programming late, to go back and watch from the beginning, because Dr. Vaughn really painted a great picture of where we're at in the opening part of this conversation. We encourage you to share this video and to watch it again for those of you who may have joined a little bit late. Moving ahead and looking ahead to next year and to 2022. We will continue on in our conversation about what's happening at Red Hill. Joining us on Monday will be Ernie Lau from the Board of Water Supply. And we look forward to that conversation as well, because we know that many of you still have questions out there about what is happening with Red Hill and that situation there.
Yeah, have a happy new year. Please stay safe. If you haven't been boosted, please go ahead and get that. When you are planning your celebrations for tonight and over the weekend, please do keep Dr. Brown's warnings top of mind. If you have an opportunity, you can always download this podcast. It posts usually kind of mid-afternoon. You can find it wherever you get your podcasts. It also airs on channel 50, 6:30 p.m. and a.m. So lots of opportunities to take in this content. Again, thank you so much for joining us, not only today, but throughout the year. We appreciate your support, your comments, and we'll see you right back here on Monday.
Happy New Year. Aloha.
This episode of Spotlight Hawaii is brought to you by Beachside Roofing.